so we're going to take a typical example of a low back sort of pain patient. So we're going to start with a quick assessment for the low back patient. We're going to look at some possible symptoms, see if anything becomes more aggravated with particular postures. So we'll start with Ben, first and foremost, leaning backwards, just feeling what that feels like. Does it feel smooth? Does it feel painful? Any pain there?
A bit stiff.
A little bit stiff. Okay, so we're going to side bend, sort of just seeing if there's a one-sided problem. Okay, a little bit stiffer on the right side possibly. We're going to go diagonally into the left, feel what that feels like. That's a Kemp's maneuver, and then the right Kemp's. So we're just kind of feeling the spring from our side of the point of view, and then we're obviously checking if there's any pain. So that's that. There may be a little bit of slight irritation on leaning backwards in Ben's case, and that's possibly because he's got maybe a little bit more sway forward at the at the pelvis, and then that may increase the lumbar lordosis, which may lock up the joints a little bit more. Now, what I usually also do is like to check how far forward he can bend. So let's get you to bend forward now. So in this case, we can see Ben's got really good range. You can actually touch his toes, touch the floor. His legs are fairly locked out, so there's no major bending. We could bring the legs together and obviously check if there's any subtle increase in the bend. We can't really make it out here in this case. In the case that it was a little bit short, we'd be sort of thinking possible low back muscles that need to lengthen. They may be a little bit short in this case. Possible glutes and also hamstrings could also be affected here. Now, I also like to check postures in the seated position to try and elicit discomfort or possible symptoms as well. So I'm going to get Ben to sit right here in this particular spot here. And then I also, if you can, just with your hands, grab kind of under here. So yep, and here. Just kind of use the table maybe here, so there's a little gap there. Now sit with your body nice and tall to begin with. So even if you have to slide forward to actually do that. Good, nice and tall with the body. Now what I want you to do is just simulate a little bit of load by pulling under the table. So let's check that. And we'll just see if there's any increase in symptoms there. So it should be okay in the neutral posture. Now we can exaggerate different postures, more like slumping positions. So we can bring Ben down through a slump posture and get him to pull at that point. If I wanted to try and see if there's any increase in like disc symptoms or neural tension, we can get into straight leg, raise one of those sides, see if there's any increase in sharpness or reproduction of low back pain with referral down the leg. So we'd be looking for that. We can do that both sides. So we can lean, bend back, arching the back, and again, grabbing under the table, sort of just to try and determine, does extension increase the pain? Was it forward flexion that increased the pain, or was neutral kind of a little bit of a pain source as well? In this case, prolonged sitting would be problematic for Ben, or anyone with an IT type job, or prolonged sitting postures. This would likely wind up the problem. Okay, so now we've figured out. Look, Ben's got good range overall through his low back in his toe touch. He has some slight irritation into extension. The Kemp's maneuvers weren't overly positive or painful. However, there was a slight discomfort in there for him. In the seated postures, again, Ben, was there any obvious postures there that felt uncomfortable for you?
Mainly leaning back.
Again, extension. Okay, so we're getting a definite tendency here, or sort of picture that Ben's low back pain is a bit more brought on with the low back extension. Okay, so what we might do now is get Ben laying face down. And so here is, some people lay on their tummy when they sleep. So Ben, do you lay on your tummy at all?
No.
No. Okay, so I was just curious because in some cases, people who lay on their tummy, obviously with a soft bed, the tummy starts to sink deeper and deeper into the bed, and then that usually causes an increase in the lumbar lordosis, the increase in the angulation at the low back, and obviously can cause further irritation on those joints there, okay? So a lot of time the facet joints, they're the ones that become irritated. Their job is really to guide motion in the low back and obviously throughout the whole spine. And their job is not really to bear weight or force, okay? So obviously when they do become painful, the capsule's usually inflamed, so that's like a capsulitis type symptom. And again, we can palpate that, sort of have a feel. We can have a look at what the L sort of like the SI joint's doing. We can have a look at what L4, 5, usually the most common segments that become irritated. Again, Ben's got pretty good spring through there overall, so it's not majorly problematic in his case. I'm going to check this side just for completeness. Okay, so we just palpate, press, trying to interpret what is the feeling of that spring doing. Again, we're looking for any hard blockages that may indicate sort of joint fixation, and usually those points are the ones that we want to work on. So, presuming that Ben had a little bit of irritation on the joints there, I'm just going to give you a quick example of what an adjustment might look like. So Ben, I'll get you to lay on the right side of your hip, turn and face me. Okay, bring off the shoulder, hand here, nice and strong. And then we also bring the leg there. I'll bring him a little bit closer to my side. We want to just allow the leg to roll off the table. Is that feeling okay? All right, we pick our segment, whichever one feels the most stuck, and then we'd roll him a little bit further, put some click through that, okay, just to get that joint moving again, get it pumping, and try and improve the actual motion on that segment, okay? So that's one way that we can work it. Another way that I like to get in there is also with some soft tissue work. So, you know, I can use, in this case, an easy Theragun, okay? So we put that in the low back, rolling over all those low back muscles there, and we can add some leg movement to try and improve range of motion. So here, this would be technically trying to add a little bit of flexion to the low back muscles. So we're just trying to increase and improve that blood flow through that area so we can sort of increase some of the healing as well. Okay, and how that muscle functions and lengthens and contracts. So we go through that. Do that maybe for a minute or so just to kind of get things moving. Good. Okay, now I might also get Ben from this position to go face down actually. And then we can choose to do things like needling in that area as well. So we just raise that up, make sure we've got access to the area appropriately, okay? Kind of feel out what is that muscle tissue doing. If there's any tight spots on that, that's where we want to kind of target with the needling. So in this case, I'll just do a single needle point. Okay. Now, if you have obvious sort of fear with needles, we don't ever have to do this. It's just only if the patient's comfortable. Again, we won't recommend any treatment if we don't feel it's going to be beneficial for you. So in this case, we'll check with Ben. Ben, you okay with the needles?
Yeah.
It's fine. Okay, so we're just feeling our area. I'm just putting into the muscles just beside the spine here. Tap that in. Be sure not to touch the needle itself, so the actual part that's going in. Okay, and just slowly progress it through. And you know, we can check back with Ben, is there any pain or being increased in that position?
A bit sore.
A little bit sore, so that's where I'll probably just choose to leave it there. Let that settle in for a minute or two. Again, with needles, technically what we're trying to do is increase the blood flow to the site, and obviously if there's taut bands of muscle that are kind of affecting how that muscle contracts and lengthens, we want to try and break up that taut band so that it improves its function. Okay, So we'll take that out now. Okay, needles out. No signs of blood. Okay. Now we can get Ben back up. So usually how I like to perform everything is a pre-test, treatment, and then post-test to see how we did. So let's get Ben just standing back up. We can go back through just the key ones here. So in the case of extension, so we're feeling, did that improve with our treatment method? Okay, was there any more, is that a little bit better in terms of your pain or discomfort there?
Yeah.
And we hope it is. It's not always that case, but look, we want to try and affect change straight away as much as possible. And ultimately, look, with any treatment, we may feel that, you know, at the time we get some obvious improvements. Post-treatment, sometimes there's a little bit of pain, discomfort. So I usually say a little bit of no pain, no gain is okay, but we don't want to create crazy levels of discomfort post-treatment with our treatment, okay? So look, if you've got low back pain, come on in, let's get you assessed. And